As we are here today, and I feel like I should have heard all these presentations before I was preparing this one, because I feel like there were so many answers to my question that I had here when I was hearing our speakers and our keynote speaker talk about things. The answers to my questions, the answers that I was looking for. How do I get my nurse residents ready for this next few years of need that's there? And today we are going to talk about what the journey for our nurse residency program has been in getting our nurses prepared to that next level. The focus is on using the Nurse of the Future core competencies. How many of you guys have heard about Nurse of the Future core competencies? Yeah. So it is, there's a funny thing that always comes to my mind. The first time I was talking to some of my leaders, somebody asked me, are you talking about nurses working as robots, or, what is this? And I was not very happy listening to that. But then this was the core. This was where not many people know what that stands for. And again, it is very important to bridge that gap when our nursing students are coming into the workforce, right? There is that gap. And how can we bridge that gap in a practice setting? So that's what today's presentation is all about. So said green. The objective for the presentation is to explore how we used this in our program and in facilitating and adapting that to empower our nursing workforce. A little bit about where I work. I work at UT Southwestern, University of Texas. And there is a whole lot of, when I moved to Texas and to this organization 2 years ago, and I went back home the first day of work, I was like, there's a whole city that is UT Southwestern. They even have their own police department. And it's so big and it's so huge. It's taken me a while to get used to what all things are there in UT. We provide care to 16 counties in the north of Texas region, which is over 8.5 million people. And these are our people who we care for. Our flagship hospital is CUH. We call it CUH, but the full name is William P. Clemens Jr. University Hospital. That's our flagship hospital, but along with that, we also have Zale Lipsey and over 70 outpatient clinics that provide care to the population here. Some more accolades. This is what the hospital CUH building looks like. It's 3 towers and 12 stories up. So again, they are color coded, and it took me a while to learn all the colors to know where I'm going. But just to give you a glimpse of, there's 820 plus beds just in the inpatient setting, which provides 80 plus specialists and subspecialty care to the population. And the Dallas campus also houses outpatient settings as well. With the ambulatory care in Ashton, we also have a psychiatric clinic, which is multi-specialty, and a clinical specialty clinic for physical therapy and rehabilitation, right? So these are all, so this is where that city is. It's really a city by itself. Some accolades that we always talk about, it is the #1 hospital in the DFW Metroplex, #2 hospital in Texas, and in all the procedures, and I'm said the total procedures in that count list is 20. We are top in 19 of them. So again, there's a lot of, it's a academic, a teaching hospital. So there's a lot of work that goes behind, a lot of research that goes behind the care that we provide for our patients. We are also overall 5-star rating with the CMS. And, I always think it's very hard to please them. But, here we are. We are doing a great job. We are also among 9% of nation's hospitals that have achieved the gold standard with Magnet. Okay, so not just Magnet Hospital, we achieved the gold standard with Magnet, which, as we all know, is the highest level for nursing care or excellence that's provided. And to the end of that is our nurse residency program, which we call as UT Southwestern Nurse Residency Program, has been accredited twice with distinction. And we are going for our third distinction next year. So it is a great program, and it has grown over the years. And a lot of our nurses that we are bringing in through our residency are staying in our organization and making this organization the great organization that it is, right? So it is, it's a lot of pressure and weight on us to make sure that when we get them started, we are giving them a good foundation in this program. Now, the reasons for why we need the program, right? There's lots of literature out there. Workforce force challenges. This is not just for UT, not just for Texas. This is nationally at national level, 17% turnover rate with RNs, and eligible to retire in 10 years, right? 33.5%. But at the same time, if you look at that last 25% of our new nurses that we are training, we are putting all that resources in to get into the workforce, they're leaving within the first year, right? So we, as you know, we are putting in all this effort, through providing the education, residency programs, but they're leaving, and there's that burnout of 45%, right? So there's a problem that it's not getting fixed, and that needs to be addressed really soon. Need for residency program, again, very well documented. I don't know if you guys remember the 2010 IOM in Institute of Medicine, when they put their report out, nurse residency and nursing was in the forefront. That's what they said is going to save healthcare in the following years, is nursing. Invest in your nurses. So from then on, there has been many studies into this residency program. What are the benefits of the residency program? So you can see all of those things. And the last piece is that ROI, talking with the numbers, putting your data to where it actually means something to the organization as a whole. And you can see that there is a great need for that nurse residency program. What is our story? In terms of our residency program, we started with 2 cohorts in 2016. They were small cohorts, 30 to 50 each. In 2019, we got our first accreditation with distinction. 2021, we increased our need for nurses was going up. So we increased from 2 cohorts to 3 cohorts. Anybody remember 2021? We all remember 2021, right? The need, it was not just for UT Southwestern, it was everywhere. Everybody needed nurses. So we increased to 3 cohorts. 2022, we had our second accreditation with distinction. 2023, when we got all that feedback from the accreditation body, from PTAB, about our program, we had to take a hard look at our program, right? And in the next slide, you will see why. But we needed to give more structure to the program so we can keep the nurses that we are bringing in and give them a good foundation. That's when we started looking at competencies that will support the program and the purpose of the program within the organization. And that's when NOFCC, or Nurse of the Future core competencies, came in to the picture. So we revised our curriculum based on the NOFCC and structured it differently. Now, in between 2024, 2025, we have given that structure. We have taken it from our table and given it out to the unit. So now there's pathways, there's structured follow-up and feedback. And again, we could not do it with the team that we had. So we have to expand our team to make sure we are investing into our nurses. Okay, so that's where we are right now with that. Looking at the need for all of this, this is ANCC's report of how you can see that trajectory of how increase has been. It went from 3,600 to 4,300 the new residents that are coming into the program. And if you look at UT Southwestern, the nurse resident, there was a 182% increase from 2021 to 2024 in the number of nurses that we were bringing in just within the nurse residency program. This, again, we were investing in this huge group. This was a pipeline into our organization to deal with the deficit that we were having at the bedside. We now have more nurses at the bedside. We needed to make sure that we are investing in the right place and we are investing in them to build them in to grow into our organization. That was a great need for us. A little into the practice transition program accreditation from ANCC. How many of you guys know about the accreditation program? So the nurse residency accreditation, there's the CCNE accreditation as well. The accreditation was part of the bigger project where the need was to make sure every residency program is standardized across the board. That was the need. That's why we started, ANCC started doing that their accreditation program. And this is their model. They were looking at, of course, Benner's model is the baseline. You can see that arrow going both ways. But they have 5 components that they wanted standardized in every single residency program so that we can make sure that every single new nurse that's getting onboarded from an accredited program are having the same kind of information and resource and support, right? So that is their model. What we wanted was to add a little bit more structure to this at the granular level at UT Southwestern, right? So we had to comply with all of these standards, and we chose to use Nurse of the Future core competencies as the added structure we needed for our residents. Nurse of the Future competency is a very interesting model. And I like the piece where it is integrated. It's integrated in the education academic side, as well as it can be used in the practice setting, right? So it's kind of bridges that gap you may see when you have those new nurses coming in and to work into the bedside. But it is positively impacting patient safety, improving patient care, increasing retention, and also making sure that your nursing workforce is competent to meet the current needs of your patient and healthcare. A little overview of Nurse of the Future core competencies is 10 evidence-based competencies within this. It was developed by Massachusetts Department of Higher Education experts. And this came right after the IOM's report came out, right? This was inspired with, what was in that report, the need for a structured residency program. It's focused on practice readiness and leadership development. That leadership development piece was really important. It's really important for our nurses to be leaders at the bedside, and it's really important for them to continue to grow as leaders in this healthcare system. And it's used both in the academic and institutes and in healthcare systems. This is what the model looks like, the original model from the Massachusetts department when they created it. You can see the knowledge, attitude, and skills that are, it's broken down. It's assessed across the board within practice and within the environment of practice. With the 10 competencies at UT Southwestern, we really felt that there was an additional need to add that critical thinking piece. It was a big need based on the feedback we were getting from our unit leaders, from all the people who were working with our nurse residents. The critical thinking was something that was identified as a need. So we added those. So for us, the competencies were 11 instead of 10. So we assess our residents on those 11 competencies. We give them an opportunity to do a self-assessment when they come to us at the beginning. So we get an idea and they get an idea and understanding really of what the expectation is within this program, right? Oftentimes when they come, I find a lot of them not knowing what to expect. I have heard everything from I thought I was going to sit in a classroom to I only can work 2 days a week. And it's anything in. So it's really hard to gauge because they come from so many different learning organizations, colleges. It's really hard to gauge what their expectations are when they come into the program. It is our job to lay out those expectations up front, to say, this is what we want, we are looking for in our nurses in this organization. So it gives them a very early insight into the expectations for UT Southwestern. We follow up with them all throughout the residency every month in that first 6 months of their residency when they are mostly in orientation. And then we also do touch points with them at 6 month and at 12 month so that we can show them that continuum, right? Before Nurse of the Future core competencies, they would all be in the residency program. They all have successfully completed the residency program at 12 months, right? It was a 12-month program. There was really no measure to say, these are competencies you met, and hence you have successfully completed the program. There was no measure. Now we have a measure. I think this was more important, not just for the resident, but also the facilitators. Me as a practitioner or a manager, it is easy for me to have this conversation with a new nurse and help them understand what their scope and role clarity is when they are a professional nurse. I also want to bring in, I know someone mentioned the International Council of Nursing. This is not just a United States problem. This is a problem globally, right? If you can see, they have a model. They have ICN sent out a report in 2022, and their strategy to deal with the healthcare crisis, the nursing shortage crisis that's there, is education for entry to practice and ongoing professional development for nurses, right? So it is not just for us here in the United States. Globally, we are also looking at the same things, right? And why do I bring this here? I think sometimes we work in silos. We think this is our problem here, and we just try to find solutions all by ourselves. But when you open yourself to the world, you will see that you don't have to work alone. There's already people working. There's already strategies that have been placed. If you have time to look at the whole report, I think it's like 79 pages something, but it has examples how different countries have utilized some of these measures, examples of how they have built their nursing workforce in those countries. And you will see there's examples from South Africa, from all different places around the world, and you will see that they're dealing with the same issues and they applied something that worked for them, right? So it's easy to see that these are, it is easy to verify that we are going along the same work path that the world is going through. So what did we do? We had a structure to our program. That's why we had 2 accreditation, right? We had structure to our program. What we decided we had to start, we were not going to, blow up the whole structure and start from scratch. But we took pieces of what we had and tried to align it with the goals. And it made it not just clear for the residents. I have to say, it also made clear for my own department, my the nursing professional development specialists, my UBEs or unit-based educators. It made it clear to them, what are we trying to achieve with this program? What is it that we want from our nurse residents? So the structure remained the same, the core structure. We added that Nurse of the Future core competencies to the program goals and guided the whole thing. So let's look into how did we actually do it, right? This is just talk. How did we do it? There are many levels of this. I will start with development and design. I'm aligning it with our PTAP accreditation standards. But in development and design, we introduced, like I said, we had those program competencies. We never had program competencies. We have program competencies now. So anytime a new nurse is coming, we give them skill-based competencies, right? You'd give nursing competencies onboarding competencies, unit level competencies, but what does it mean to be a competent resident nurse coming into practice, right? What does that mean? So we put our NOFCC competencies into program goals and competencies. And you can see these are statements. These are not one-time skills that you check off, right? This is the overall growth of that resident through. So our nurse educators and our nursing professional development specialists, they review this with each and every resident, and we give them feedback as they are going through their journey for the whole year, right? It's for the whole year. We also use the NOFCC to guide and streamline our curriculum. Before, it was, we needed seminars, so we were plugging in all the holes, having people come speak because we thought this is what they needed. But we used our Nurse of the Future competencies to guide our seminars and made it more streamlined to focus on those highlighted competencies that we wanted from them. We wanted critical thinking, professionalism, a big thing. ANA scope and standards, we talk about it. We really do talk about it. What I do with them is do a gallery walk. So they're not just sitting there and listening to me go through all the scope and standards. They're walking around room, writing down what does it mean when they read this ANA scope and standard. How did they apply it in their practice so far, right? So ethical questions, concerns they had. And it's so enlightening. Sometimes I just feel so proud of my residents when I see that they have advocated for a patient and they realize what ANA code of practice they used and they were supposed to utilize, right? It also makes sure that the peer support, right? They realize that they are not by themselves in this journey. There is 90 other people in this room who are going through this journey with them, and they learn from each other, right? It's not, it is hard for me to know what a new nurse feels like because it's not what I felt like 20 years ago. It was very different. It was very different. If you ask me, when I started in working with nurse residents, one of the first things that would go through my mind is, why do they not know this? Why is this so hard? This is not how I was when I was a nurse back then. Why don't you love nursing? And very soon I realized it's not. I have to meet them where they are. I have to meet them where they are. I cannot expect them to be where I was 20 years ago, right? So we have to build this into our program. So these are few examples of what competency-based curriculum looks like in our seminars. And the highlighted pieces, I'm not going to go through all the classes they have, but we need to see impact on practice. How do we do this assessment? We want to see that they are doing safe patient care, bedside shift report, interdisciplinary rounding, escalating care according to the plan, advocating for their patients. Providing, delegating, having accountability, big piece, accountability. I didn't know I was responsible for this patient. I thought my preceptor is. I didn't have to take the responsibility, right? So where does that come? You have to get them out of that student mode to know you are an independent licensed practitioner. You are responsible for your patient. Practice-based learning. How did we did this on the ground? This is the pathway. Every specialty has a pathway that they have to follow, which gives them guidelines on competencies that they should focus on. And it's incremental. So, it doesn't look the same. Every 25%, the pathway looks different, right? And towards the end, we don't even provide them the goals. They have to create goals for themselves. They are taking ownership of their own learning, right? So towards the end, this pathway looks a lot emptier, right? And they write their own goals down and we hold them accountable for that. Every 25%, we assess them with what we call as compact assessment. Compact stands for, it's an acronym for clinical judgment, organization, motivated to learn, problem solving, ability, attitude, and accountability, communication, and teamwork. But this is a very structured way of giving them just-in-time feedback during their orientation and picking up on things that they need help with. How many of you guys have residents that follow the plan? Perfect 10, and they get out of residency on time. So we also have a plan for that. So again, this is, we tell them it is not a cookie cutter program. We also have to build in what are their educational needs. How are they faring in going through all of their processes, all of that learning? We might have to sit down with them and give them more focused, constructive feedback and an education plan to be successful. The goal is that we want them to be successful. That is our goal. So that's where the team builds that in. This will all not be possible without our leadership support. And I have to thank my leaders who are great visionaries and who have seen that need and invested in our nurse residents and our staff nurses. So we have to operationalize this, we had to add 3 more assistant nurse manager position. I have one of them. I used to be at one of their professional nursing professional development specialists. And we hired more of those professional nursing professional development specialists. But the bigger piece, the people who actually grow our residents are our unit-based educators and our preceptors. We had to invest in them, right? And we had to invest in our preceptors and train them, because guess who our preceptors were? Our new graduate residents who have less than 2 years of experience, right? That was our pool. We didn't have a choice. This was our choice. So we had to invest in our preceptors as well to make sure that they are ready, and put it where our leaders would get, the aligning it with the organizational goals, saying we serve a purpose. This is the impact of this residency program on the growth of the organization, right? All of these things that organization is looking for, we are providing with this residency program. Outcome measures, I will not go into the details of this, but again, a lot of numbers there, but this is our Casey Fink survey for the experience of the nurses. We track how they feel with their role confidence, with their role satisfaction, and their organizational commitment. And you can see there's a relationship between all of those things, right? If they're not satisfied, they're not going to stay. So what do? We compare this, and we also enhance our program based on those needs. This is our ANCC. We got a report card in April from ANCC. We get a report card every year. And in comparison to other programs, you can see our program completion rate is around the same ballpark as the national average. Also, our turnover, we are at a much better place. We are 11%, where national turnover rate is at 23.8%. So these are some of the impacts that we speak with that program. We need to have a sustenance plan. It doesn't just stop with creating something and just sitting back, right? You have that strong foundation, you have a structured program, you need to have an evaluation process in place. You just don't do evals and then, so all of those evaluations are what we go off of. The real question to ask is, what do you want from this program? Right? If you have a residency program, you need to ask, what do you want? This is what our residents want. We ask them this question too. And they want growth, they want career opportunity, they want to contribute to the profession. These are all things that we want too. They just want it in a different way. So we need to know, how can we provide that to them? On the accountability piece of this, UT Southwestern is holding our residents to these standards, and the program helps them to meet these standards. They are accountable for that piece. They are accountable to fulfill that circle, so they are that complete nurse who's going to contribute to that workforce. And just an added piece, these are things that we can guide them. You don't stop them at being that nurse. We expect our new nurses to be leaders sooner. They have to grow up fast in this current healthcare scenario. So guide them to the right ways. Some of the nurses, they don't know what are other options that are available within the bedside nursing that they could utilize. They find fulfillment in those things. So guide them through that. With that, my time was over, way past my time. Um, so I want to say thank you. If you have more questions, I have my email down there. And I think we all need to work together to lead the future of nursing. So we all need to think together and work together to deal with that. So thank you very much for listening.